Yes, Mr. Ashish Govind, he was suffering from avascular necrosis of the both hips. Of late after COVID or caused maybe multiple things, multiple causes for AVN. So he was suffering from severe AVN of both hips. Both left side and right side were in stage 3 and stage 4, for which he underwent a co-decompression surgery with small stem cell therapy as well, which was done probably a couple of years ago, but which was not successful, and he was suffering from pain again. He was limping. He was unable to do his day-to-day activities. Even his regular home activities were also very difficult, and he was walking with a significant limp, and with that limp he came to me. And because already by the time he came to me, his both hips were in stage 4 with hip joints being deformed. So after proper counseling, we have proceeded for the hip replacement, but a staged hip replacement, that is one after the other. First I have done the left hip in the month of November, and after 6 months we have done the right hip, and his recovery was drastically well. He's doing fantastically well. Within 2 weeks, today he came for suture removal, that is a clip removal, and he's walking without any support, without any discomfort. There is no pain, there is no limp. And the good part is, with the latest implant which I have put in his hip, it is called a ceramic total hip replacement, which has longer life than regular metal implants, which is proven to have a better quality of life, better longevity of the implant. So this ceramic implant is very much suitable for young patients who are suffering from AVN hip and who need a hip replacement surgery. So this hip replacement surgery is quite rewarding. If you are suffering from avascular necrosis of the hip or any kind of arthritis of the hip which is affecting your day-to-day activities, you can comfortably, safely proceed for a hip replacement, get your mobility back, get your pain-free active life back.
My name is Ashish Govind. I'm a resident of Cherlapalli in Hyderabad. I was diagnosed with avascular necrosis, AVN of hips, in both my hips, and I underwent a core decompression, but that didn't yield any results because I was already in third stage of AVN. So it necessitated for me to have hip replacement surgery done on both legs. So I underwent the hip replacement surgery in November on my left leg. And the recovery period was, the general recovery period is 6 weeks for you to start normally without any support. But my recovery, thanks to Dr. Dikshit, I was in good hands, and the recovery was faster than I anticipated. And I started walking without any support in 3 to 4 weeks, I would say, if I recall correctly, in November. And then on the advice of the doctor, I did not immediately underwent second hip replacement surgery on my right leg because, as the doctor suggested, I should delay it as long as possible. If I could bear the pain, I should try to delay it. But it became unbearable recently. And on 11th of this month, I underwent another hip replacement surgery on my right leg because the doctor knew the kind of implant that was used on the left leg, that similar kind of implant can be used on the right leg. The surgery itself took lesser time in comparison to the first one. Also, the recovery has been faster because I know what are the do's and don'ts, and I'm used to now with that first surgery. So the recovery is even faster than what it was on the first leg. So it's been just 2 weeks. I'm walking without any support. I came to my doctor's visit, second visit, without anybody. Without anybody from my family coming here. I just came myself. Of course, not driving, in taxi. And the stitches have been removed today. I'm walking normally. All I want to say, whoever are there suffering from similar situation, right, AVN, and if you are fearing how difficult hip replacement surgery is, how difficult the recovery is, how long it takes, nothing to worry about. In fact, like I said, after my first surgery, I was very cool and I was very confident that it is nothing to be afraid of, and the recovery is very fast actually. So it has a significant impact. Without the surgery, I was limping on both the legs, and the pain was consistently there. Even though it was I was bearing it, but still it impacts your lifestyle. the pain throughout the night while you are sleeping. I mean, it's always playing on your mind. So it brings you down psychologically also, and physically, of course. You're restricted from doing a lot of stuff that you would usually do. But after the surgery, there is a hell and heaven difference, and the difference is visible. And I'm very confident also. The stress has gone almost, and I'm sure within few months I would start leading normal life. Thanks again.